Hi, my name is Chelsea Spence. I'm a junior nursing student at FIU, and I currently do not have any experience working in the healthcare industry, but I'm excited to start going to clinicals so I can have an experience of what the healthcare system is actually like. Okay, what does nursing mean to me? I believe that nurses are the backbone of the healthcare system, that they're central caregivers, that they're team workers, that they're logical thinkers, and nursing goes beyond just the scope of practice of caring for your patient. You really work to impact your patient's lives, and you work hard to save lives during nursing. So nursing is very vital, and I'm really excited to be one. What do nurses do? Nurses promote health. They try to prevent illnesses within their patients, and they also work with informing the community about health issues. As a current nursing student, how would I introduce myself to my patients? Okay, let's go and find out. I would start by knocking. I would knock on their door, allow them to let me in. Once I'm able to enter the room, I would go ahead and wash my hands, of course, and introduce myself to the patient. Hello, my name is Chelsea Spence. I'm a nursing student at FIU, and today I will be assisting your nurse in caring for you. Okay, now it's time for me to identify the patient that I'm talking to and make sure that who they say they are is who they actually are, to make sure that I'm giving the correct care to the correct patient. So I would come over and I would look at my patient's armband or wristband to identify. Excuse me, sir, may I please have your name? May I please have your name?
Courtney.
Courtney, and can I have your last name as well?
Spence.
Okay, yes, and can I have your date of birth?
7/15/69.
Okay, perfect. I have identified the patient, and I know that his name is Courtney, and I checked to see on his wristband if that corresponds. Now, would you like me to call you by Courtney, or is there any other name that you would like me to call you by?
Courtney.
Courtney is fine. So I will be helping Mr. Courtney today, and I would let him know that and be able to build rapport with him by stating who I am and why I'm here to help. So I would say now, hi, I'm a FIU student. I'm currently studying fundamentals, and I've practiced many skills, I've taken tests, and I've filled out my compliance tasks in order for me to be here to care for you today. So I will be assisting your registered nurse, and today I see on your chart that you have joint pain and that you were prescribed the narcotic morphine. However, I am not able to administer morphine because I'm just a nursing student, and that is beyond my scope of practice. So I would say to my patient now, okay, your nurse will be able to administer the medication for you, but however, as a nursing student, I'm still able to take your vitals today, and I'm still able to do your documentation with the permission of the registered nurse. Okay, so if this introduction would be a little bit different if I had introduced myself to a patient who was a veteran, simply because I would know that veterans probably went through more traumatic tasks than my regular patients. So I would ask the veteran about their service, how their time of service was, and I would just want to know this so I can have prior history so I can match it up to what is already written in their files. Now, once I ask the veteran about their service, about any injuries that they may have pertained, I would analyze this of the veteran to make sure that the veteran and ask them if they have any prior knowledge, or I would ask them, do they know who the president is of the United States at the moment, or current events, to make sure that they are still in their right mind, cognitively, of course. And once I'm able to analyze that, I will analyze them mentally, physically, and take note of that. I will also assess the veteran's health and ask the nurse to about their prior care. Did they receive any care during their service? And was the care different from what they are receiving now after they have been admitted from service? And if they were pleased with their quality of care, any pain they're expecting, or any pain that they currently have. I would also thank the veteran for their work so that they know that we care as nurses, that we care about our veterans, that we care about their health. And yes, that is it.